Welcome to Topsail Insider, where you can hear all about the businesses and events in the beautiful coastal towns in the greater Topsail area of North Carolina. Coming up, today's episode is all about Alpha Osteopractic and the owner and therapist, Dr. Brittany Forbes. She goes beyond general physical therapy. She is your fellowship-trained neuromusculoskeletal expert. She offers personalized, one-on-one premium services with a full-body, holistic approach. Stay tuned. We have a lot of information here for you. Experience a new level of luxury on Topsail Island at Saltwater Suites in Surf City, North Carolina. With no nightly minimum, you can enjoy short getaways or an extended stay. Each suite features luxury bedding, full kitchens with dining tables and dishwashers. And all suites other than the 3 ADA suites have full-size washers and dryers. And don't forget about those beautiful ocean views. 24/7 self-check-in provides a hassle-free and seamless experience. Saltwater Suites is the perfect choice for your next beach getaway. Book your next Topsail visit at saltwatertopsail.com or call 910-886-4818. Saltwater Suites, Topsail Island's premier luxury hospitality experience. Hello, everyone. Welcome to Topsail Insider Podcast. My name is Krista, and I am your host. Today, we are talking to Dr. Brittany Forbes. She is the owner and physical therapist of Alpha Osteopractic. Welcome, Dr. Brittany, and thank you for joining me.
Thank you for having me.
Do me a favor and just give us an overview of Alpha Osteopractic and the primary focus of your practice.
Of course. So Alpha Osteopractic is my vision of how physical therapy truly should be. After 13 years in physical therapy, I've seen a lot of changes and unfortunately a significant decline in healthcare and the actual care of patients. So I decided to leave the traditional model of healthcare and open Alpha Osteopractic, where I get to be the one that truly gets to take the time and be there for my patients and do what's best for them. I try and treat every patient the way that I would want my grandmother treated. And I want them to get exactly what they need at the time they need it.
When I was building your episode, I had to do a lot of research. And I needed to learn the difference between just general physical therapy and also your specialized subset, which was the osteopractic part of that. Can you explain to me and the listeners the difference between general PT and the specialized training and tools that you use as an osteopractor?
So physical therapy is a lot like the medical field in that you get a baseline education in grad school. And when you graduate with your doctor of physical therapy, you can go into a number of different fields within physical therapy. So one of those is orthopedics, which is all of your joints, people with neck pain, back pain, ankle sprains. But there are lots of other avenues that physical therapists can go, such as pediatrics, geriatrics, neuro, skin care, respiratory care, cardiac care. So just like physicians have to go into one realm, your family doctor is not the same doctor that you go to for your skincare. You would go to a dermatologist, or for a joint problem, you go to an orthopedic physician. If you're having joint issues, you want to look for an orthopedic physical therapist.
Okay.
There are specialties within orthopedics. One that's a board certification is an orthopedic certified specialist. That is one credential that I hold as well. And then you can go into more depth of specialty. There are residencies available in physical therapy. They're just not mandated like they are with physicians. So medical doctors, once they graduate, they have to do a residency. In physical therapy, it's a choice to do a residency or not. And then the highest level, just like with physicians, is a fellowship training. So fellowships are, again, specialized. So they're specific to the area that you want to practice in.
Which you did.
Yes.
Right?
Yep.
Okay.
Yeah. I do have a fellowship training. I'm FAOMT credentialed. And it really, truly was practice changing. After years practicing, I was finally at a point where I could go into fellowship and complete the program. And it's amazing how much more you can learn even after many years of practice, doing all of the additional coursework and training and practice and mentorship hours you learn so much and you can really specialize your practice and get that more efficient at what you're doing.
I encourage the listeners to go to alphaosteopractic.com and click on their services and conditions that they treat, and you'll see a really extensive list there. But just to go over a few of the conditions that you treat.
I see a lot of neck and back pain, both acute and chronic. And a lot of times that goes along with things like radiculopathy, which is a big, crazy word. Exactly. Radiculopathy is when you may have neck pain, but you also have pain that's going down your arm, and you may have tingling or numbness. A lot of people know of the term sciatica.
Yes.
That's a radiculopathy of the sciatic nerve.
Okay.
So that's one nerve that could be symptomatic in the leg.
Is it a pinched nerve? What is sciatica?
So sciatica is basically that nerve is angry.
Okay.
It's symptomatic. It's very common that the nerve gets irritated right at the back for a number of different potential reasons. It could be a disc bulge is a common one, but also just a joint stiffness where one of the little joints in the back isn't moving the way that it should. And that's creating a lot of irritation to the nerve right where it comes out of the spine.
Like just basic arthritis?
Arthritis can be a component of it as well.
Okay.
It can also get irritated at the hip. A lot of people have heard of piriformis syndrome. Piriformis is one muscle in the hip. There's no pop quiz later, don't worry.
No. I would fail.
But the sciatic nerve runs right underneath that muscle. And in some people, it actually runs through the muscle. So if that muscle gets very tight for any number of reasons, that can also irritate the nerve. So sometimes people get these symptoms going all the way down their leg into their heel or into their foot. And you have to figure out why they're getting those symptoms and where it's happening so you can treat just the root cause. Oftentimes when people get pain, they feel it in one area, but the actual base foundation cause of it might be a different area. So you have to explore and find that. That's really common with radiculopathies or those pains, aches, shooting pains, or tingling and numbness going down the limbs. A lot of times they're coming from the neck or the back.
Wow. What else are you treating people for?
I treat a lot of knee pain, especially arthritis. One of the things that I was able to do in my fellowship was actually collect data for a randomized control trial. We're still in data collection currently, but it'll be coming out hopefully in the next couple of years. But we use Periosteal Electrical Dry Needling. Don't worry, we can talk about it. It's dry needling with the use of electrical stimulation around the knee, and it is an incredible benefit. Changes symptoms so well.
So a lot of people get knee replacement surgery. Is this something that you're employing before it gets to that point?
Yeah. So even people who have been told that they have bone on bone, we see massive changes in reduced pain, reduced stiffness, improved function, less medication use, and a lot of people deciding that they don't need surgery. They don't want to go through the knee replacement because they feel good. So I treat a lot of shoulder pain that comes from a variety of different causes and a lot of ankles as well. Ankle sprains are very common. Yeah, basically any joint pain, sprains, strains. I treat a ton of headaches.
I was going to ask you about the headaches.
A thing that's really closely related to a lot of headaches is TMJ, or
what is this?
Jaw pain.
Okay.
So the joint that we use for talking and chewing, it's a fairly small joint, but it's a very powerful joint. And people can have pain there for a number of different reasons, such as too much motion, not enough motion, muscle issues. So TMJ, or that jaw pain, can have a lot to do with the neck, especially the upper neck. So sometimes when you're getting treatment with potentially a dentist and looking at grinding or having bite guards made for nighttime sleeping, those can be very beneficial and helpful things. But if it's not getting rid of 100% of the symptoms and you're still having some troubles, a lot of times we need to look further. We need to make sure we're addressing the joint mobility of the actual jaw, but also looking at the upper neck and all of the muscular connections in between.
Incredible. I saw on there fall risk. What are you doing for fall risks?
Fall risk can come from a number of different things. Sometimes it's getting older and getting weaker. Sometimes it's from accidents or injuries and people have lost strength or from neurologic conditions. But fall risk comes from a decrease in balance, a lot of times a decrease in strength. And our balance comes from 3 different systems. It comes from our eyes, it comes from our inner ears, and it comes from something called proprioception, which is basically where all of our muscles and our joints, they have these little tiny receptors, especially where the muscles attach by the joints. And they're constantly sending information back to our brain. That's why we can know if our eyes are closed, whether our arm is up in the air or down by our side. And we know whether we're standing upright or laying down, even if our eyes are closed. And all three of those systems are trainable. And sometimes people have had a decrease in function in all three systems. And sometimes it's really mainly one system that's struggling. We always do a full comprehensive evaluation initially so that we know what's going on. Once we really know what's going on, whether it's a vestibular system or inner ear problem or visual compensation or weakness, then we'll decide what exercises or trainings are going to be best for that person. Some things initially are best done in the office with me there for safety, but most of the time we want to have things that people are able to do at home to continue building on that progress and getting better every day versus taking a break between sessions and losing some of that progress. I do also really enjoy treating carpal tunnel syndrome. And a lot of times people get the tingling and the numbness in their hand. So with carpal tunnel syndrome, a lot of times we need to assess and address any joint mobility issues in all of the teeny tiny joints in the wrist. But carpal tunnel actually comes from an irritation of the nerve where it travels through the wrist. And sometimes people will work on that. And then they also find out that they had an issue at the neck as well.
For carpal tunnel?
For carpal tunnel. So sometimes it's called a double crush syndrome because the nerve was getting irritated in two places.
Wow.
So again, if you're going in for treatment of carpal tunnel and you're only working on the wrist and you haven't looked at the elbow or the shoulder or the neck, you may get a little bit of partial relief, but then it's coming right back after people are done with their sessions. If you find that, you need to make sure that you're getting treatment assessment of the neck, the whole entire limb. We use a lot of dry needling with that as well. And you get to just bathe the nerve and all these really nice chemicals for pain relief and improved blood flow to help it heal. So it's really nice to be able to prevent surgery.
Absolutely.
Especially on the wrist and hand because we use them so much every day. And it's really hard for people to lose their independence for a while over having to have a wrist wrapped up and not being able to use it for a while.
Yeah. All righty. You are a doctor of physical therapy, but you also have a long list of these acronyms or abbreviations behind your name. So it's PT, that's physical therapy, DPT, doctor of physical therapy. What is FOMPT?
Fellow of the American Academy of Manipulative Physical Therapy
And
manual physical therapy.
OCS?
Orthopedic certified specialist.
The diploma of osteopractic?
Yep.
What are the other ones there?
So Cert DN is a certification in dry needling. Cert SMT is a certification in spinal manipulative therapy. Cert MST is a certification in, it's called modern strength training and also blood flow restriction training. And then Cert PBFR is a certification in personalized blood flow restriction. It's just two different companies that I learned blood flow restriction from.
Okay. Wow. You are educated.
I do love to learn and I love physical therapy.
You said now you're teaching.
Yes.
Can you tell me a little bit about that?
Yeah. So I teach a certification course in blood flow restriction training for the American Academy of Manipulative Therapy. It's wonderful. I really enjoy teaching. One of the things that is a recommended experience in fellowship is that you go and assist on courses. So we teach a ton of different courses from dry needling and spinal manipulation, the certification in blood flow restriction training, vestibular specialties. We have a lot of courses, but you get to go as an assistant instructor once you've already taken the course once or twice. And I was able to assist on a lot of courses during my fellowship. And it was such a wonderful and fulfilling experience because I would see physical therapists at one course and get to help them with a technique. And then I had a few experiences where weeks or months later, I was at another course and they came up to me and they're like, I'm so glad I ran into you. I've been thinking about you. You helped me with this one technique I was struggling with. And that week I got to help 4 people that had been struggling and hadn't seen the changes that they were hoping to. And that one new technique changed their whole course within physical therapy. And that it was just so fulfilling and so rewarding.
I was going to say that probably feels amazing, but you're probably feeling that way with all of your patients that you help have a breakthrough with their pain.
I'm very lucky in what I do because it is incredibly rewarding when you get to help people break through pain or achieve new goals. When they come in and they're so excited, or they got to throw their son up in the air for the first time in 4 years because of a shoulder injury.
Yeah.
It's just so incredible to see that joy in people that it's very easy to love what I do.
I can tell by the way that you smile that you love what you do. And when you're talking about it, it comes out. I want to go back a little bit. I want to know where you were born and raised and what it was like growing up and your education and what led you to osteopactic PT here in Hampstead.
Yeah. Hope you have time for a little story.
I do.
So I was born in Utah at Hill Air Force Base, and my dad was in the Air Force, and we moved from Utah to New York and then back to Utah and back to New York again as part of his Air Force career. And then he retired when we lived in upstate New York. So I got to stay in the same area for high school. And then I went to college near Buffalo to Damon College. And it was really a great place. It just fit. So I had a wonderful experience there. During grad school, you do a lot of internships in physical therapy. And one of my mentors said, get an out-of-state experience. Go somewhere else, because every state has different laws around physical therapy. Getting an experience somewhere else helps you understand some of the benefits of certain states, some of the restrictions, how different states practice. So I found two that were near Charlotte.
We're glad to have you here.
I love North Carolina now. So I did those two internships and ended up deciding to stay in North Carolina. I got an offer in Sparta, which is a teeny tiny little town.
I was about to say, I've never heard of Sparta.
It's up in the mountains. It's in Allegheny County, so it's very close to the Virginia border. But they have a nonprofit hospital there, and they needed a PT. And it was a really interesting opportunity because I got to do mostly outpatient, and I also got to see inpatients too. And it was a really great experience to be able to keep my skills in both areas coming out of school.
Yeah.
And learn a little bit more about what my true passion was, what I loved about this area, what I liked about that area, and what I didn't necessarily want to continue for the rest of my career.
Yeah.
And as far as acute care, it's wonderful.
I was about to say, so working in the acute care in the hospital was not your thing.
It's an incredible field, but it just wasn't my heart. I'm an orthopedist at heart.
Gotcha.
That's just where my passion lies. But yeah, I was promoted to the rehab manager a few months after I started there. And because it was a nonprofit, I got to do a lot of really cool things, like host fundraisers for the hospital and the PT department. And we were able to raise enough money to get new equipment. We were able to raise enough money to open a whole new building for the PT department because it grew a lot in that first year while I was there. And I made some really great friendships. So it was really wonderful to be able to do so much for the community in the hospital as well as just patient care. I was there for a few years, but every couple of weeks I'd get a call from my grandfather telling me that I needed to go out to Elizabeth City and meet one of my college professor's brothers. And the really funny connection there is that my grandfather played hockey until he was 74.
Wow.
And he actually played against one of my college professors. And we didn't know this connection until the day of my grad school graduation. They physically ran into each other in the doorway and both went, "What are you doing here?" So they figured out the connection. And so every time they would play against each other in the league, I would get the phone call telling me that I need to go and meet his brother, who was a physician in Elizabeth City, and his best buddy owned 6 PT clinics in the region. About 2 years of getting phone calls regularly, I said, okay, I'll go meet them. I'll go meet them. I'll go see what this is all about. And after going out there and meeting them, I figured it was a good opportunity. He had multiple clinics. There were a lot of PTs there, so a lot of opportunity to learn from other PTs and get truly into just an orthopedic setting, all outpatient, which was where I wanted my career to go, was into outpatients and orthopedics. So I went back and I put my notice in, and a good friend of mine who was an OR nurse, she had started dating a local guy, and he said, "You know what? I have a friend who lives in Elizabeth City. He grew up there." He goes, "He knows everyone. I'll send him a message. You can meet him. He'll help you with whatever you need help with." So it was meant to just be a
Like introduce you to the
Yeah,
city,
like
show
a
you
resource.
around?
Yeah, a resource so that I knew which areas to avoid, like which areas were good, or, hey, I really want to try out kite surfing. Like, who do I go to? And so we had exchanged a few messages just saying, hey, like I'm moving to the area. I'm open to recommendations. And we ended up setting up a lunch date. And it was just meant to be, hey, tell me about Elizabeth City. And it ended up turning into a 4.5-hour first date. We were just chatting away. And a good 10 years later, here we are.
You got married.
2 kids. And so it was an unintentional first date.
Wow.
Yeah.
A blind date.
Yeah. Completely blind date. That wasn't meant to be a date, but it turned into one. But yeah, it was meant to be.
How old are your kids?
They're 6 and 4.
6 and 4. And you said 13 years in physical therapy?
Yeah.
And spent some time in Jacksonville, right?
Yeah.
What made you decide to leave Jacksonville?
Leaving Elizabeth City we decided as we were getting married that we wanted to find some place that we really wanted to settle down and buy a house and raise our kids. And so I started looking around, and my husband's fiance at the time, his only requirements were that he had an ocean and an airport within a half an hour.
Gotcha.
Those were his requirements. And so we were looking all around, and we got some different job offers, and I had found this clinic up in Jacksonville that was a good fit. It was one-on-one therapy. The owner seemed to really be passionate about patient care. And so we took the jump. We moved down about 4 months before we got married back home. And we lived there for about a year. But we had heard so many wonderful things about Hampstead. We had a really good friend who lived in Hampstead, but also worked at the same clinic that I was at.
Oh, okay.
And so she had introduced us to Old Point. And she actually found our house for us and set us up with a real estate agent.
2 doors down.
Yeah. Yep, just a little bit away. And so once we found this house, it was very similar. We walked in the front door and it was home. So we bought our house in Hampstead, and I was doing a fairly long commute up to Jacksonville. And over the years, there were more stoplights and more traffic, and it was getting a little bit hard with childcare. And we knew our son was going into kindergarten, and I'd done the fellowship right after COVID. I did my full year of fellowship. So there's just so much going on and a lot of demands. And we knew that we really wanted to be able to be close to home and be able to help out with our son's schooling and have a little bit more closeness to our community versus just always leaving Hampstead. It was an ideal time to get out of the traditional healthcare setting because it's changed so much.
Right.
Healthcare doesn't really seem to be about healthcare anymore or about the patient. A lot of healthcare has been taken over by corporate entities and business people, not healthcare practitioners. So I wanted to be able to truly put a healthcare practitioner, myself, back in the driver's seat of what our practice or our clinic is about.
And when did you open up your business?
So I opened my doors in April of 2023
All right.
here in Hampstead. I made the jump. I'm really happy that I get to give back to the same place that you live and where your kids are growing up and the schools that they're going to. It's really nice to be here in Hampstead doing what I love.
Absolutely. Okay, let's talk in more detail about the services you offer. What is it? How do you do it? And what tools and instruments you're going to use? And what does it treat? So let's talk about your spine and extremity manipulation.
Yeah, so that's one component of what is termed a lot of times manual therapy is spine or extremity manipulation or mobilizations. So manipulation, a lot of times people think of and they hear cracking your back, cracking your neck. So you can also crack your knuckles, but you can do that for really any joint in the body. So when that's indicated, when you need that mobility or the input, we'll do that. And what it is, it's just a quick movement, but a very small movement. And that's why it should be very comfortable and very safe. If you're going to somebody and it's really not comfortable, just give them that feedback so that they know that they need to adjust their hand position or their technique. But that helps a lot of times give a springboard to a lot of the things that you're trying to accomplish in your physical therapy so that you're getting the movement in the joint that you need, but you also get a release of chemicals and hormones that help to reduce pain and give feedback, you can actually get improved muscular function to those nerves that we were talking about.
Yeah.
Those nerves carry signals to muscles. So when you crack a certain level in the back, a lot of times you get a little bit better output and function
Somewhere
in the
else in
muscle
the-
that nerve innervates. So if you're trying to work on something very specific like quad strength in your leg, you can crack the back at that level of the nerve that innervates the quad, and that can help you get more out of the exercises that you're doing for your quad.
Got it.
There's multiple ways that we use joint manipulation or mobilization. Mobilizations are a little bit slower, and you don't normally get the cracking noises with it, the pops and cracks.
Let's talk about the dry needling. Tell everyone what dry needling is, first of all.
So dry needling is the use of filament needles, or very teeny tiny needles that are inserted into specific points targeting muscles, tendons, ligaments, near nerves to achieve an outcome. Typically, a lot of times that's pain relief, increased blood flow, increased healing. A lot of times people see the needles and they're like, oh, wait, so it's the same as acupuncture. The needles are the same, which that's the tool, but the use of them is different. The whole theoretical construct behind acupuncture and dry needling is different. Acupuncture has a lot to do with energy flow and meridians, and they treat a very different area than what physical therapists do. Going to an acupuncturist, you can do acupuncture treatment for a variety of different things, such as weight loss and smoking cessation. They also do treatments for pain, but they do a lot of things through what are called meridians and energy flow. And that's a whole separate practice.
Yeah.
That's not my study. So dry needling, we use the same type of needles, filament needles. And that just means that they're not hollow. So they're much, much smaller than what you would see like getting a shot at the doctor's office.
Oh,
and the reason that it's called dry needling is we're not injecting anything and we're not drawing anything out. Dry.
Gotcha.
Dry needling really got its first concept from a physician who was doing injections on patients and had a thought to himself, I wonder what outcomes patients would get if I didn't actually inject anything. So he did a study where some people actually got an injection when they were doing an injection, and some people got an injection, quote unquote, without any medication in it. And a lot of the outcomes were the same. People got pain relief and healing and a lot of benefit. A lot of it has to do with what happens when you insert a needle into the body. And there's tons of studies on this, that when you put a needle in the body and then you stimulate it either manually by like winding and things like that, or through electrical stimulation, we get a whole cascade of things that happen in the body. We get a release of our body's natural opioids. So we get pain relievers from our body. We get a secondary non-opioid mechanism of pain relief. So we get a 1-2 punch on pain relievers in the area. But we also get other chemicals and hormones that cause a massive increase in blood flow. So the little teeny tiny capillaries, they really open up and they bring a lot more blood flow to the area. And we get a lot of our immune system responses for healing. So now our body's sending all the little cells to the area that we need for healing. So it's not just whether the medication's there or not, but we just get such a response from our own body on healing and pain relief.
That is so
improving
cool.
things.
So interesting. Okay, what about instrument-assisted soft tissue mobilization?
Yeah, so it's called IASTM for short, but a lot of people call it scraping. So you may see it put on websites or things like that as a service as IASTM or scraping or Graston. Basically, IASTM is using tools. Most often they're metal, like steel, but they're shaped differently and they have beveled edges to align with tissue. And you can use those to give a different input into the body so that you can reduce pain, improve blood flow, get tissue moving. And
you're pressing it into the body, into the muscle?
There's a lot of different techniques that you can do with it. Some people be very heavy and push deep into the skin, and theoretically they're hoping to break up fascia or scar tissue. That was a very widely used concept for quite a number of years. Over time with research, we've seen a lot that you don't probably need to be so heavy-handed. You don't need to be bruised and feeling beaten up to do that. but that when you use even lighter strokes and different techniques, what you're doing is you're giving an input into the body, and then the body will make those changes that you're looking for.
That?
You can get muscles to relax and move better and stretch better. You can create some of that blood flow that we were talking about earlier to get the body's awareness and attention on an area to help the healing process along.
So cool what you do. Okay, let's talk about cupping therapy.
Yeah, so cupping, there's a variety of different types of cups. There's silicone or kind of soft-sided cups, and there's hard cups. There are chiropractors and acupuncturists and massage therapists that all use different versions of cupping. In clinic, I have a couple of types of soft silicone cups, and then I have hard cups that use a little hand pump to suck the air out. And so you can use it to lift the skin and the fascia, which helps create a decompression and allow a lot of blood flow in the area. And you can do cupping with the person relaxed, where you're working on the tissue and getting things moving. But I also really like to use cupping where we put a cup over an area that's really restricted in the tissue and then do active movements. So we might put cups on the gastroc near the Achilles tendon and then actually do Achilles and ankle stretches.
Oh, stretches. Okay.
So that you're moving the tissue underneath that cup. So you're getting the body to do the movement, which really reinforces that improved movement staying. Sometimes when we do very passive modalities, like just laying on the table, it feels really nice, but it doesn't last long. We want to get the body and the brain involved so that those changes stay.
Tell me about body tempering with the weighted cylinders.
So body tempering is definitely more new than most other things. Body tempering, we use weighted cylinders. So I have steel rollers. Some of my patients like to call it a giant rolling pin. I have everything from about 25 pounds to 85 pounds. And then I can pair two together to even get up into the 130 pounds.
Wow.
Yeah. If you think about foam rolling, a lot of people are familiar with foam rolling. A similar concept in the broad pressure, but now your body's relaxed. You're not having to try and balance on a roller and control yourself over this rolling object. Your body gets to be relaxed and then get this deep pressure stimulus.
And now, are you using this mostly with the clients that you're training? Or is it for physical therapy across the board?
Yep, across the board. I use it for physical therapy patients. I use it for performance training because you can use it right before workout as a preparatory stimulus to get more blood flow and loosen up those muscles so that you're really ready to work.
Yeah.
And you can also use it as recovery. So sometimes when people come in a day or two after a really big workout or competition and they're really sore, we'll do a number of things to improve their recovery and get them ready to be training again.
We're going to talk more about the training in just a minute. I want to cover one more thing, the blood flow restriction therapy.
So blood flow restriction training uses specialized cuffs. And the goal is that we're going to find out how much pressure it takes to stop the blood flow into that limb, which you only ever do blood flow restriction at the very top of the arms or the very top of the legs. So once you know how much pressure it would take to stop the blood flow into the arm or the leg, which would be creating a tourniquet, you can take a percentage of that, and that's how much pressure you apply. And that percentage, what it does is it allows a little bit of blood flow into the limb, but it stops the blood flow out of the limb. And what this does is it tricks the body. And so you get fatigue a lot faster. So where you're working out, you might normally be able to do 20 or 30 repetitions. If you kept that same weight, you would only be able to do maybe 5 or 6 or 10. So you hit a level of fatigue a lot faster because you're trapping what are called metabolites, or all the little things that happen in your blood when you're working a muscle really hard, like doing bicep curls. You're trapping that, and that tricks the body. And so we get a lot of the same responses as doing really heavy resistance with very light resistance. So normally when you start working out and you're like, okay, I want to make my muscles bigger, it takes a lot of work. You have to lift 70 to 80% of your 1 rep max, which is how much you can lift one time. And you have to do that consistently over 8 to 12 weeks to really see changes in muscle mass. With blood flow restriction, we can train as little as 20 to 30% of a 1 rep max. So pretty lightweight.
Wow.
And you start to see a lot of the same changes in strength or hypertrophy in 4 to 6 weeks.
You're getting faster results.
You can get a lot faster results. And this is very useful in rehab settings because if you have a surgery or an injury and you're not allowed, it's not safe to put really heavy resistance onto that limb, you can use blood flow restriction training with very light loads to maintain and start to build that muscle back faster.
So cool.
So it's
oh my gosh,
huge in rehab. There's even ways that you can use it very early in rehab to help to prevent some of the atrophy or the muscle loss that happens right after an injury or surgery. And then as you're going along, you can change the application, like how much pressure you're using, what you're doing with it. And it can be used with walking, cycling, rowing for strength benefits, but also for cardiovascular benefits. So we've seen improvements in what's called VO2 max, basically a measure of your cardiovascular, your heart health. We've also seen improvements with performance. So testing people with sprinting and cycling, that we see that it doesn't take them as long to get tired or time to fatigue. So they can sprint harder for longer.
When you're working on the cardiovascular part of this, where are you putting the cuff?
So it's still always on the legs
on the arm
or the arms.
leg. That's it. Okay.
Yep.
Are you all four at the same time or just
Never.
one? Never. No, okay.
Never all four. It can be one leg. Like if somebody just had a knee surgery, you would probably start with mainly just that leg. You can also do both legs, or you can do both arms or one arm.
Okay.
Never all four, because that would create too much restriction of blood getting back to the heart.
Back to the heart.
Yep.
Okay. That makes sense. You offer programming.
So programming is always a part of physical therapy.
Okay.
Because you need to load the tissues for them to heal properly and for people to get back to doing what they love to do. The specific programming service that I offer, that's more of a month-to-month thing, is designed for wellness, getting back into working, sport optimization. I work with a number of different athletes, semi-pro, lacrosse players and such, that I design their workout programs or their training programs for them. I've always been an athlete and I love athletics. I also really love the science behind programming. So you can find a lot of different workouts, but being able to have something that's truly tailored to your goals, that you know that you're going to make progress and you're not spending your time just willy-nilly working random things. Programming comes down to not only the exercise that you're doing for the muscles that you're trying to work, but also the rep schemes, the set schemes, the rest time, the day-to-day, what you do on each day, intermixed with cardiovascular stuff, other sports that you may have going on or competitions. And I like the puzzle of finding out what people's goals are, where they are, everything they have going on in their life, whether it's sports or work or school or other events that they have coming up, and being able to really tailor a program so that they can make the best progress to get the best results.
Let's go into a little more detail about your sports performance program and coaching.
Yeah. So one thing with sports performance and programming is considering the season. So your in-season training and out-of-season training should be way different. So when you're in season, you need to make sure that you're game ready or competition ready. And when you're out of season, that's a time that you can really focus on resolving any imbalances, really building up the best foundational strength and working on some of the hypertrophy, and then focusing on any agility or sport specific things that you need. Then when you transition to in season, it should be a little bit more about maintenance when it comes to the strength and hypertrophy, still agility training, but also incorporating the best recovery techniques. So that when you finish with one game or competition, you're recovering quickly so you're ready to train and then be prepared for the next competition or game. Every sport is different, and especially if people play more than one sport, you have to juggle where you want to put your workouts because you need to be working out in season along with the recovery techniques with your games or competitions.
What is hypertrophy?
So you're right. You got it right. Hypertrophy is actually building more muscle. So strength and hypertrophy are actually two different things. A lot of people, I don't think, know that.
I don't.
Hypertrophy is actually building muscle. Strength is that capacity. And then there's different aspects too, like power. So that's your ability to lift the item quickly or push through somebody else quickly. Power is a whole different dynamic. Endurance is a different measure, and that's that capacity to continue that activity for a longer duration. So depending on the sport, you really want to focus your energy on building up the things that are going to give you the most performance or the best edge in your sport. Every sport is different, so it's fun to be able to really fine-tune programming so that you're not wasting your time.
Continuing on with your programming, you talk about lifestyle coaching and habit guidance, stress management. Tell me a little bit about how you help your clients with that.
Yeah. So workouts are only one aspect of programming. If you only ever focus on just the workouts, you can do too much because there's a fine balance between stress and recovery to actually get true progress. So if you apply too much stress to something, it breaks down. But when you give it an appropriate stress or a good stress and then a good recovery, you actually get a lot of progress and growth. But when we're talking about the human body, there are so many different things that play a role in how the body responds to things and how we feel that you really want to take all those things into consideration when you're trying to optimize your sport or just get back to feeling and having good energy and things. So nutrition is a huge component, hydration, sleep is incredibly important, stress management. And it's not that we should have no stress or no cortisol, because that's a common stress hormone that people talk about. Cortisol is actually a good thing. We need it in our body. We just want it to be mostly in the morning and not so much in the afternoon, because then it can have some negative effects on sleep and body functions, timing, cyclical. So when we talk about programming and sport optimization or health optimization, wellness optimization, we want to have a good global picture of the whole lifestyle and how we're functioning. Because then again, we can focus our efforts on the areas that are going to make the biggest change. It's very hard to change everything all at once. It's too overwhelming. It's hard to change habits. So really taking the time to see where we're at with all of these different metrics, then we can pick, okay, let's focus on A and B. Let's get these habits sound. Let's work on things. And I'm here to support people. So I don't want to just send one file and say, okay, have fun. I want to be an active part of helping you achieve your goals. So there's always check-ins and feedback, and we adapt everybody's program to what they need.
You do a comprehensive intake form. Tell me about the form and how long that takes.
I like to have people do the intake form before we have our first assessment. That way I can already look over it. And we're not taking time out of our one-on-one time for me to read your forms. But that intake form, it's going to ask a lot of questions about what your goals are and what your current status is. Are you exercising at all? What types of exercises are you doing? What sports are you playing or not? How you feel your nutrition is, how your hydration is, how your sleep is. Do you wake up feeling rested? Some people will be like, yeah, I'm in bed 8 hours every night, but they don't wake up feeling rested.
Yeah.
So different qualifiers around some of these big concepts so that, again, we know where to focus our efforts to see progress and changes.
Your 60-minute assessment, tell me what you're doing in that 60 minutes.
So for programming that 60-minute assessment, if they're local, can be in person, and we can really look at some more physical, like movement things, restrictions. I also do virtual.
Wow.
With that, it's going to be a video, and we're going to go through a lot of active movements, but it'll be less of like just this base range of motion. We'll take a quick peek at that, but we're going to look probably a lot more at the gross movements, like ability to squat, ability to deadlift, row, bench, so that we can see where your movements are and the quality of them. But we look at all of those physical components as well as discussing all of the additional things like the habits and the nutrition and the hydration and the sleep. Again, that's giving us that global picture of where we're at and where we want to focus our efforts to really get the ball rolling. We may have check-ins at different intervals depending on what they need. So I do a lot of maintenance, wellness, and then the sport optimization.
What kind of gym do you have in your space there? You're working people out. I want to hear about the gym.
Yeah. My gym, we have a full rack and a bar, and we have plates. They are bumper plates, so they can be dropped if necessary, depending on the sport. I have adjustable dumbbells, so we can go all the way up to 80 pounds per hand if we need to for stronger folks. I have some kettlebells. I have a variety of bands. I have suspension trainers. I have cones and agility ladders. So I have a nice variety of different things, boxes for box jumps and step ups. And I have a treadmill. So I do a lot of video analysis of running.
Tell me about that.
So if somebody wants to do a run analysis, they come in. We do a history first and a screen to look for any old injuries, restrictions on mobility of the joints, things like that. So we know a baseline orthopedic health. We go over running history and mileage, shoes, all of the different things that affect running. And then we get set up on the treadmill and you get running, get to your normal pace, gait, style. And I do video from a couple of different angles. And we have body markers on some of the key joint areas so that we can see it very easily on the video. And then I screencast that up to a TV that I have by the treadmill. So it's very easy to see and people aren't hunching over my little phone.
Okay.
And we'll go over the actual running mechanics and what's happening at the shoulders, the back, the hips, the pelvis, the knees, the ankles, the feet. Depending on what we see, movements in the joints, it can give us information on our strength, our motor control, things that can cause or be related to high instances of injuries.
Mm-hmm.
So we know, okay, we're having a trouble where either our core isn't strong enough for endurance or our hips, ankles. We can look for these things in the mechanics, and that helps us fine tune again what we're going to focus on in our strengthening or our cross training so that our running becomes more efficient.
Mm-hmm.
We get a little bit faster a lot of times, but we're also a lot less prone to injuries with addressing any of these mechanics issues. You want to be able to go out and enjoy your run, but still make it more efficient and safer.
One final aspect of Alpha Osteopractic I want to cover is the insurance, which we've already hinted at a little bit. You do not take insurance. So Alpha is a cash-based physical therapy out-of-network practice. Explain why you've chosen this model for Alpha and the benefits it offers your patients.
I don't directly bill insurance, so that way I can spend my time truly focusing on the patient in front of me and doing what's going to be absolutely best for them. Unfortunately, a lot of insurance is very restrictive when it comes to interventions. And over the 13 years that I've been in healthcare, I've seen a lot more restrictions put in place, a lot more confounding coding and regulations, and we're not going to cover this, or we won't allow you to do these two things on the same day, or only allowing a couple of visits. And there's a lot of restrictions around time. You have to do a certain number of visit or a certain number of minutes of a treatment to bill for it. Otherwise, they won't pay for it. So you're taking a lot of the things about somebody's care, about their treatment plan, and focusing on the billing aspect of it. So I wanted to take all of that crap out of it and be able to just be with the person in front of me, give them my knowledge, my experience, and say, this is what I think is best for you. I wanted to be able to practice PT the way that PT should be practiced. And growing up, my grandfather owned his own business. And I heard time and time again over the years, do the right thing for the right reason, and you won't have to stress about the business. And that's always been in my heart. One of his hockey jerseys is hanging in my gym.
That's so cool.
Yeah. So he's with me every day. And I think it's so true. When you're running a business, if you do the right thing for the right reason, everything else will fall into place.
You provide a super bill.
Yeah.
So tell me about that.
So that's where, like, when I say I don't bill insurance directly, it's because when PTs, especially small clinics, try to coordinate or contract with an insurance company, the restrictions and the reimbursement rates are abysmal. However, if you and I go into a contract and I collect that payment up front, I can give you a receipt or an invoice that has the codes. So it's very similar codes as to what was done and the amount of time, and then the diagnosis codes, what's going on. And then when you submit that, depending on your insurance plan, you can get reimbursed. Some patients get 100% and some get partial. Every single plan is different. On my website, and if you need it, you can always call me, text me, I'll send it to you directly. I have a sheet that walks people through the questions to ask their insurance if they want to understand their out-of-network benefits.
Yeah.
Because plans have co-pays and co-insurances and deductibles and different time frames.
That is so great that you offer that. I love that. Is there anything else that you would like to let the listeners know about your billing and pricing?
Just to be aware of where you're going and what benefit you're getting. There's phenomenal therapists out there, and there are some not so great ones out there too. The most important thing is that you feel like you're getting the service that you need to truly achieve your goals. If you're not seeing good changes within 2, 3, maybe 4 visits, you need to be revisiting what's going on. And the other thing is, don't be afraid that if you go to therapy someplace and it's just not a great fit, it's okay to look for a different therapist somewhere else. The most important thing is that you get the care that you need.
So before we finish up here, what is the one thing that you want listeners to know about you or Alpha Osteopractic?
I think probably the number one thing is just that I'm here to be a resource for patients and clients. And the most important thing is yourself. When you're getting healthcare, medical care, and this is across all aspects, be an advocate for yourself, whether that's with medical doctors or physical therapists or chiropractics or acupuncture, massage therapy. Be an advocate for yourself and make sure that the people who you're getting care from are really on your team. And it's okay if you don't have a great relationship with somebody, it's okay to find a different practitioner who you will have a great relationship with and get the results that you need. So take care of yourself and find the team that's going to work well for you.
Thank you so much. I really appreciate your time and being here and explaining all those really big words to me. All the acronyms, all the abbreviations. It's time to give out your contact information. Do you want to give that out?
Sure.
Okay.
First, I'd like to say thank you so much for having Topsail Insider. This is an incredible thing for our community, and I appreciate what you're doing.
Thank you.
But I'll go ahead and give everybody all my contact information. So phone number is 910-216-0726, and you can call or text that number. And my address is 14669 US 17 North. That's right there in Hampstead. It's across from CVS. And I'm actually in the same building as Taste of Sunrise Coffee.
Okay, and your website, we mentioned this earlier in the episode, it is alphaosteopractic.com. And what is your email address?
So it's Dr. B or DRB at alphaosteopractic.com.
Okay, and tell me about the socials. Are you on all of the socials?
I'm on Instagram and Facebook and on LinkedIn.
I will provide those links in the show notes, folks. So if you just want to click on those links, it'll take you right to her pages.
Thank you very much for your time.
It is my pleasure. Thank you so much. Thank you, listeners, for joining us today and sticking around for season 2 of Topsail Insider Podcast. And thank you again, Dr. Brittany, for telling me all about Alpha Osteopractic. Hey, if you enjoyed today's episode of Topsail Insider, please show your support by clicking the follow or subscribe button on your favorite podcast listening platform. You can also follow us on Facebook, Instagram, Twitter, and YouTube. Please also go to topsailinsider.com and join our mailing list by clicking on the Make Me a Topsail Insider button. While you're there, you can click the Send Me a Voicemail button and let me know exactly what you're thinking. Your message just might be on an episode of Topsail Insider. You can email me at krista@topsailinsider.com or call or text me at 910-800-0111. Thank you for listening and supporting Topsail Insider and our local businesses and nonprofits. These are our neighbors and our friends, and together we build a mighty and a beautiful community I'm super proud to be a part of. I'll see you around Topsail.
Hey guys, it's Leah with Topsail Talk. I explore local businesses, services, people, and activities in Topsail and its surrounding areas, and I post videos about them. You can find and follow Topsail Talk on Facebook and Instagram. You'll never know where we're going to go, but if you try one of my stops, be sure to tell them Topsail Talk sent you.